Hey guys, welcome back. As you know, we've been doing our practice question series all month long, and today concludes our STD, women's health, and pediatrics and non clinical content questions. So let's get into these for today. Question number one states: a 24-year-old female presents to the office with complaints of recent changes with her menstrual cycle. She states for the past few months her cycle has become irregular. She states that she is also battling facial hair that has made her feel down and depressed because she cannot manage it. The nurse practitioner continues the exam and she is working through differential diagnoses. Based on the patient's presentation, what should be a differential diagnosis? Is it A, folliculitis, B, nothing, have the patient to follow up in 3 months to assess her cycle, C, polycystic ovary syndrome, or D, electrolyte imbalance. All right, y'all take a moment and tell me what you got in the comments, you guys. All right, you guys, I always tell you to read the stem of the question first to ensure that you are answering what is even being asked, right? So the stem of the question states, based on the patient's presentation, what should be a differential diagnosis, right? So, okay, the patient came in, she's explaining that her menstrual cycle has changed over the past few months. It has become irregular. She's explaining that she has this excessive facial hair that she cannot manage. What are some things that the MP should start to begin to think when you hear of things in this presentation, right? Always talk about key identifiers. Folliculitis, we can take that out. Although that does affect hair, when you're thinking of hair issues, you can have folliculitis, but that doesn't have to do with the success of hair that we're talking about. B, nothing, have the patient to follow up in 3 months to assess her cycle. Yeah, you do want to have her to follow up and continue to assess if the cycle is having any variances or if it continues, but that's not a differential diagnosis here. C, polycystic ovary syndrome is the answer. Yes, because think about it, PCOS, they commonly have the hirsutism and the irregular menses, right? So when you see that, even when the terminology is not there and it's explained, you should still be able to um, identify based on key identifiers. All right. Question number two. The nurse practitioner has diagnosed the patient today with bacterial vaginosis. She's completing her plan for treatment. How should she treat? Is it A, azithromycin, B, Rocephin, C, Flagyl, or D, penicillin G? Tell me what you think. All right, you guys, the stem of the question states, how should she treat? All right, so the nurse practitioner has given this patient a diagnosis of bacterial vaginosis. So how do we treat BV? So looking through these, C is the best answer. Flagyl is the first line therapy for bacterial vaginosis. I always say, the fishy odor is that key identifier associated with it, and I say think F for the fishy odor, F for Flagyl. All right, question number three. The nurse practitioner and NP student are discussing immunizations. The NP student is inquiring about which immunizations are given at birth. Which immunization or immunizations should the nurse practitioner explain to the NP student? Is it A, rotavirus and Hep B? Is it B, Hep B? Is it C, rotavirus, Hep B, and DTaP? Or is it D, rotavirus and DTaP? Take a moment and tell me what you think. All right. So the stem of the question states, which immunization or immunization should the nurse practitioner explain to the NP student? Okay, so in the scenario, the NP student is inquiring about which immunizations are given at birth. So what should the nurse practitioner tell her is provided at birth? Is it A, rotavirus and Hep B? Mm, no, we don't give rotavirus at birth. Is it B, Hep B? Yes. Hepatitis B is what you give at birth. That's the immunization that you provide. And I say, think B for birth, B for Hep B. That's all you need to give at birth. All right, and our last question for today. The nurse practitioner is explaining ethical and legal terms to the NP student. They're discussing a term that means fair. What term below goes with this definition? Is it A, justice, B, veracity, C, beneficence, or D, autonomy? Tell me what you think in the comments. All right, you guys. So the stem of the question states which term below goes with this definition and the definition of meaning fair. And the answer is A, justice. Remember, we've been going through these terms, but justice is fair, fairness. Veracity is truth. Beneficence is to do good. And then autonomy is that independence, right? All right, you guys, I hope you have found this helpful. If you hadn't had a chance yet, go back and check out these past few weeks of practice questions. We've done 3 a week on Tuesday, Wednesdays, and Thursdays. So there's about 12 videos so far. And be sure that you like, comment, and subscribe, and share to whomever you may think may find this beneficial as well. And make sure you meet me back here. Bye, y'all.